is that very, very high rates of smoking are still observed in a number of occupational settings, particularly in construction-related occupations, and they're much higher than in other areas of the workforce where there have been huge successes in bringing down the prevalence of smoking. Why construction in particular? It's a good question. One hypothesis is that we haven't had the inroads in terms of workplace bans on smoking. We know that in a lot of white-collar occupations, the actual bans on smoking on site had a real impact in reducing the smoking prevalence. We also know that white-collar workplaces were most likely to have on-site health promotion programs, better access to supplemental health insurance, employee assistance programs. So those are two good hypotheses as to why. The dangers to health are huge. If you look at differences in health status, longevity, etc., between white-collar and blue-collar workers, there's an enormous difference, and most of that difference is made up with chronic diseases that are related to smoking: lung disease, heart disease, and cancers. Those are the big ones. There are a number of occupational exposures that are quite common and very serious cause of lung disease: asbestos exposure, silica, dusts, fumes. And we know that there's an augmenting effect with smoking, that a smoker is at greater risk of those health consequences when they're otherwise exposed. The obvious solution is to give smokers the assistance they need to quit smoking. That would reduce the health effects that are directly and indirectly related to smoking. Secondary solutions are providing environmental supports, setting a social environment at the workplace where people are not exposed to smoke and the access to cigarettes, to support their efforts to quit smoking on their own, and to keep new employees from coming into the workplace and establishing a pattern of smoking there. Many people in the construction and renovation sector said that they themselves had banned smoking on their worksite because it was a marketing feature. The more affluent clients, as well as clients such as educational facilities and healthcare facilities, wanted smoke-free workplaces, and they would put this right in the bid for contracts. We're finding that a lot of employers in these sectors see not just the health benefits, but real economic benefits to themselves. A healthier workforce, a happier workforce, and they see economic costs avoided in terms of productivity, fires, accidents, risks, and it can also make the company a more appealing company. There's a marketing feature to being a smoke-free workplace. It was a marketing opportunity for high-end renovators. They knew that the clients did not want smoking on the site. They weren't happy with smoking on their job site, and so people would start to put it right in the ban and advertise themselves as a smoke-free work site. It was a real marketing advantage. Quite a bit of research has been done in the United States and other settings where employers have been encouraged to establish smoking bans and give more access to their employees to smoking cessation services, and these have been highly effective. There are pockets where it really is the norm to have a completely smoke-free workplace, and the employers were motivated to do this largely for economic reasons, and it has been a huge success. It hasn't been without its pitfalls getting set up. There has been some conflict, but for the most part, there are real success stories that we can emulate. Ontario has a full range of smoking cessation support services available to people who can access them. They're available through employers in many places. They're available through family health teams, your doctors. They're available through pharmacies. They're available through quit lines and websites. There are a number of different services available that people can take advantage of when they know they're available. There are huge health and economic benefits to moving forward on two fronts. One is to move complete workplace smoking bans out to the boundaries of the property. And the other is to ensure that the people who are working in those workplaces have access and know that they have access to the support services they need to quit smoking when they decide for themselves that they're ready to quit.